Good afternoon, everyone, and we thank you once again for joining us on our webinar. And as National Caucus and Center on Black Aging and the NIH National Eye Institute National Eye Health Education Program welcome you to our webinar today on dilated eye exams. Know the importance. Our esteemed presenter today is Dr. Cheryl A. Reynolds. Dr. Reynolds is a professor at Nova Southeastern University College of Optometry. Also, she is currently co-chair of the National Eye Health Education Program. Dr. Reynolds, thank you once again for returning to educate us on eye health. The floor is yours, and I know you will also continue to give a part of your bio. So thank you once again. Thank you. Thank you, everyone.
Thank you. And thank you so much for having me. Thank you, everyone, for joining me this afternoon on this brief presentation. I'm going to spend most of my time answering questions that I know most of you may have about the importance of a dilated eye exam as part of your comprehensive eye health checkup. Again, my name is Dr. Cheryl Reynolds. I am a professor at Nova Southeastern University College of Optometry in Fort Lauderdale, Florida. And I'm also past president of an organization that has been dedicated to advancing the visual health of minority populations, the National Optometric Association. And I'm proud to serve as co-chair and be a member of the National Eye Health Education Program, or NEHAP, and be the co-chair of an initiative called Eye Health, My Health, Eye Health for African Americans, to really promote the importance of a comprehensive eye exam for our African American patients, and also to just increase awareness about eye diseases that can potentially not only rob you of your sight, but can potentially rob you of your life. I always say, if you ever hear me speak, that an eye exam is more than giving you glasses or contact lenses. We can, as I said, save your sight, but there are things that we see in the eyes that can potentially impact your quality of life or even you being alive. So an eye exam and a visual health checkup is very important. Just a few things about the National Eye Institute National Eye Health Education Program. It was founded in 1988, or NEHAP, and it promotes eye health as a public health priority and prevent vision loss through outreach and education. And we do have a planning group and we have partnership, and the National Caucus Coalition on Black Aging is part of our partnership as well. And these are the areas of programming that are important for NEHAP. And unfortunately, these diseases that they have, like diabetic eye disease, glaucoma, vision in Asian, vision rehabilitation, we even have it in Spanish, because minority communities are disproportionately impacted from eye diseases. What I do want to say really quickly, I am in clinic, so if you hear some chaos in the background, please forgive me. I have clinic today. As I said earlier, I am co-chair of the NEHAP Eye Health My Health. And one of the key things in that program is really underscoring the importance of not only do you have healthy eyes, but that you are healthy overall. And so when you take care of your eye health, you're also taking care of your whole body. That's because, as I mentioned, a lot of things that impact the body impact the eyes, and a lot of times the eyes are an indicator of what's going on with the body. And so building eye healthy habits is important for everyone. It can help you manage not only your eye condition, but can help prevent further progression and potentially vision threatening complications. There's a website for our Eye Health, My Health initiative. I put the website here. We'll make it available to those that are on this call as well, through this presentation. And these are some of the areas of outreach that you can learn more about. If you go to the website, you can learn about how eye diseases impact Black African American communities. What are some eye healthy habits that you can incorporate into your lifestyle that can help I wouldn't say prevent, but slow down eye diseases, such as nutritional support, eating healthy, exercise, lifestyle modifications such as those, as well as getting a comprehensive eye exam every year. All right, so I like to make it and sort of engaging. So I don't know if everyone can see or put things in the chat, and Angela can see the chat, and I can take a quick peek at the chat. But one of the questions I always ask, and I ask my students, and I ask when I do these community outreach initiatives, can you be 20/20, or can you have 20/20 vision, good vision, and still have eye disease? A lot of times the misconception in certain communities is that, you can. So if you guys can put in the chat, but if not, that's okay. Because what I just want to make sure and really kind of underscore today is that you can have perfect vision. You can see perfectly well and have eye diseases and have eye conditions such as glaucoma. You can have a tumor in the eye. You can have bleeding in the eye. So I want patients or those that are on this call, when you leave here and you talk to your family members, your friends, just know that seeing perfectly doesn't mean that your eyes are healthy, or more importantly, that your body is healthy. So today we're going to talk about a dilated eye exam. Most of you hopefully have had a comprehensive eye exam. And what does that mean? Going to an eye doctor, whether it's an eye doctor at VisionWorks, LensCrafters, or a private practice, or a community-based practice, a veterans hospital where they have eye health, or a college like Nova Southeastern University that has eye clinic. If you have been to the doctor, part of the assessment and evaluation should be looking at the back of your eyes. So not only looking for your vision, looking at the vision and checking for the vision, but also looking at the front of the eyes that I could see the color part of the eye, the iris, but also putting drops in the eyes to take a look at the back health of the eyes, where there's where we see a lot of changes. So today my goal is to really kind of talk about the importance of regular dilated eye exam that can help you protect your eyesight. And for you as laypersons, when you go and get your eye exams, to talk to your doctor, are you dilating my eyes? And dilation can detect certain disease conditions. Now, understand, and we'll talk about this too, you can take pictures of the eyes. Fundus or retinal photography is available, but is that should that supersede a dilated eye exam? Not necessarily. It should be augmentative. It should complement a dilated eye exam. And I'll go through this as we talk about it. So I have a video, and I'm going to play this video just a bit for those that kind of don't understand a little bit, and then go through it more in detail. But this video is really detailed. So hopefully you can hear it as I play it. And the source of this video is the National Eye Institute webpage. So you can go on their webpage and see it.
A close-up of an eye. During a comprehensive dilated eye exam, the patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. Through the pupil, a view of the back of the eye. With a better view of the back of the eye, the doctor can look for signs of the common eye diseases that can lead to blindness: glaucoma, diabetic retinopathy, and age-related macular degeneration. When eyes are dilated, the doctor can clearly see the retina, shown as a lightly spotted layer covered with blood vessels; optic nerve, shown as an orange disc with a bright yellow center from which blood vessels extend; and the macula, shown as a darker area to the left of the optic nerve. View moves back to the optic nerve. This is the optic nerve. The doctor is looking for early signs of glaucoma. This patient's optic nerve is healthy, but here's what it would look like if it showed signs of glaucoma. The doctor will see changes in the shape or color of the optic nerve. The disc changes to an irregular circular shape and becomes more yellow. The doctor may also see what is called cupping of the optic disc. The disc takes on a cup-like shape, and the blood vessels expand and move away from the center of the optic disc. Glaucoma is most common in African Americans over the age of 40, people over 60, and in people with a family history of glaucoma.
View zooms out to show the entire back of the eye.
In addition to the optic nerve, the doctor can also clearly see the retina at the back of the eye.
View zooms in around the macula.
The doctor might see signs of diabetic retinopathy. Early diabetic retinopathy starts with small red dots called microaneurysms
Small red dots appear around the outside of the macula.
and can progress to leaking blood vessels, causing thickening of the retina and blurring of vision,
The retina becomes darker.
or new blood vessel growth that can bleed and cause blindness.
New blood vessels begin to grow.
If you have diabetes, you are at risk for diabetic retinopathy.
The eye reverts to its initial healthy state, and the view moves around.
While still examining the retina, the doctor can also look for signs of age-related macular degeneration, or AMD. If this patient had AMD, the doctor would see yellow spots beneath the retina, called drusen, or dark clumps of pigment.
Yellow spots appear around the retina and macula.
AMD is the main cause of visual impairment and blindness in older Americans.
Photographs of doctors using lenses to look at
That video really
close-up
kind
of
of captures everything, and I hope that really sort of highlighted or explained what a dilated eye exam is. So when you go to the eye doctor and you have your eye visit, one of the things that they potentially should do or should be doing is putting drops in the eyes. These drops, one, numb the eye. They can check the pressure. Sometimes they check the pressure with a puff of air test, but sometimes they use a blue light to check the pressure, because one of the risks for glaucoma is eye pressures. And if you have increased eye pressure, you're at a higher risk of developing glaucoma. Once they check the eye pressure, they want to make sure that your eyes are safe to dilate. And so once your eyes are safe to dilate, they put drops in to dilate. These drops take about 10 to 20 minutes or a little bit longer, and it opens up that center part so that we can see in the back of the eyes. And it's not just looking at the optic nerve and the macula as you saw in the video, but it allows us to see the peripheral part of the retina. It allows us to see the blood vessel changes in the retina. So again, as mentioned in the video, glaucoma is one of those, we call it the silent thief of vision. And there's a reason. There are no symptoms with glaucoma unless you have another type of glaucoma where the angle or the drainage system doesn't work properly, and it can cause a painful glaucoma. And we term that angle closure glaucoma. But typically the angles are open or the drainage system is open and patients develop glaucoma. One of the things we know is that African Americans are at a higher risk, up to, 5 times more likely, 6 times more likely to develop glaucoma. Not only are African American patients at a higher risk, they develop glaucoma sooner. So again, in their 40s, some patients in their early 30s, and they have higher pressures at the time of diagnosis. And more importantly, they progress with the disease more so. So it's important to get dilated early and often, to get your eyes checked so that you can have early detection, so that you can be treated earlier to prevent vision loss and improve your quality of sight and life as you age. So it's really important to have a comprehensive eye exam every year with dilation, just to make sure you don't have glaucoma, which is called the silent thief of vision. I just want to underscore, you can have really bad or advanced glaucoma and still see 20/20, because the symptomology of glaucoma is loss of peripheral sight. So you might be bumping into things because you can't see things off to the side, or side vision. And so your side vision is lost first, and then eventually your center vision. That's why patients have advanced disease, because they can't see things to the side of them, but they can see straight ahead. And so again, the silent thief of vision, because it's slowly robbing you of your sight, and there are no symptoms. As you see here, how can we treat glaucoma? Once you're diagnosed, and you're diagnosed early, we typically put drops are prescribed drops for the patients. Patients might be on 1, 2, or 3 drops to lower the pressures. Some patients might have additional surgery. There could be laser surgery, or if they have advanced disease, more advanced surgery. There's a new procedure now that they're doing with cataracts to help prevent glaucoma, minimal invasive glaucoma surgery, or for those that have early glaucoma, they could do those surgeries for. So you have a lot of options to treat the disease so that you don't go blind. What I can tell you, and I tell my patients, is if we detect it early, we treat it early, we can prevent blindness in our patients. So once you diagnose with glaucoma, you're treated early. It's so important that you use the drops as directed, that you follow up with your doctors as directed. No one needs to go blind from glaucoma. And of course, this schematic is what was in the video. You could see that here's a normal cup to this ratio, that center part. And with glaucoma, it causes you to lose your nerve tissue. This is nerve tissue around here. Again, every time I give this presentation, it's like a donut and like a little rat eating out the center part of a donut. And then at the very end, eventually there's only crumbs left. Well, once you have advanced glaucoma, there's only crumbs left. That's when patients are blind from this disease. So. And as mentioned earlier, African-American patients are disproportionately impacted from glaucoma. Therefore, if you have a family history, if you have, relatives that have gone blind and you don't know what for, those are key indicators that you should be checked for glaucoma. So each one help one, each one reach one. So if you have family members that have glaucoma, that have potentially lost their sight, then you need to find out if you have this disease as well. So educating your family members is also important. Back to diabetes, he talked about the blood vessel changes in the video. Diabetes is increasing in prevalence. In 2023, more than half the United States population have diabetes or they are at risk of developing diabetes. What I mean by that, they have prediabetes. 96 million Americans have prediabetes. And a lot of times your doctors will tell you, okay, you don't have diabetes yet to be treated, but you need to incorporate lifestyle changes, diet and exercise, watch what you eat to prevent full-blown diabetes. 37 million people have diabetes. What's important to note about that 37 number is that 8 million people are walking around undiagnosed. They have the disease. They have the risk for the disease, but they haven't been to the doctor. They haven't had a health checkup. So we as eye care practitioners, as eye doctors, a lot of times a dilated eye exam could be the initial sign that the patient has underlying diabetes. In fact, up to 1/3 of patients with diabetes are diagnosed through an eye exam. So that's why it's so important to have a dilated eye exam. And it's not just, if you can see this top image here, the patient has a lot of changes, bleeding, these yellow spots, which are signs that the retina is not getting oxygen to the back of the eyes. Patients can have advanced bleeding. If the patient has advanced changes, we as eye doctors, optometrists will refer to an ophthalmologist, a retinal specialist, and the retinal specialist will initiate treatment with eye injections or laser. And one of the things I always tell my patients when they have, moderate to advanced disease, these patients need eye injections. The injection doesn't hurt, and it's the latest treatment modality. A lot of times patients are nervous when they hear the term injections, but again, it's the latest way to treat diabetic retinopathy. Some patients have new blood vessel, as the video said. These new blood vessels can leak and bleed and cause blood to just be everywhere. And so we want to stop these new blood vessels. And so again, patients will have eye injections because they have proliferative or these new blood vessel growth in the back of the eye. But it's not just the retina. Diabetes can affect the macular areas. In this bottom image here, you see all of this yellow, that's leakage or exudative changes that occurs in patients that have diabetes. So it can cause the center part of their vision to swell up. So if you look at someone's face, that's more of your center vision. So everything will be blurry, or it may have this sort of wavy appearance in even when you look at lines, it has this wavy appearance. So diabetes can affect not just the retina, but it can also affect the macula area. And one of the things I always like to say on every call that I go on is that patients that have diabetes are 40% more likely to develop glaucoma. So it's important, again, that's another risk factor for developing glaucoma. So if you have diabetes, not only are you at risk for your retinopathy or bleeding in the back of the eye, but you're at risk of developing glaucoma as well. So what's important for our patients that have diabetes? A yearly comprehensive dilated eye exam. Yes, they can take pictures of your eyes, and we do have devices that can take pictures of the whole back of the eyes. And so some doctors may elect not to dilate and use those imaging device. But what I will say is also make sure that next year you have a dilated eye exam. I have those devices in my clinic as well, but I use them as ancillary testing. So not only do I dilate the patient, but I also take photos or imaging of the back of the eye so that I can show the patients what's going on in the back of their eyes. I can't leave without talking about the ABCs of diabetes. If we can help slow down, blindness from diabetes, because as you know, diabetes and diabetic retinopathy specifically is the leading cause of blindness in working age adults. Those are individuals 20 to 74 young. And I like to say young because my patients are still young. But if you can instill the ABCs of diabetes in your patients, or if you can remember the ABCs of diabetes as you talk to your family members, it's really the key things that you can do to slow down or prevent progression from diabetic retinopathy. So what are those things? What is the A? Glycemic control, your hemoglobin A1C, it's your 3-month blood test. Know your numbers. Every time you go to the doctor as a patient with diabetes and they do a blood test, you should know what your ABCs of diabetes are. So your hemoglobin A1C should be a number of 7 or less. In fact, the 2023 guidelines from the American Diabetes Association recommend as close to normal as possible. So even close to 6, but definitely 7 or less. If your numbers are 14, 11, 10, your blood sugar is way too high. Also, patients that have diabetes tend to have a higher prevalence of having blood pressure and cholesterol. So those things need to be well controlled as well. Patients that have diabetes, blood pressure being well controlled should be 130 over 80 or less. And make sure you're taking your medication. Your cholesterol numbers need to be really good, especially the bad cholesterol, which is the LDL. You want those numbers to be low, 100. And even now, recommendation is 70 or less. And then smoking causes all kinds of problems. So if you have a family member that smokes and has diabetes as well, you might want to counsel those individuals to stop smoking because it can exacerbate or make worse their diabetes. Blood pressure and cholesterol. I call these a silent killer, but killers, but so is diabetes. Like I said before, a lot of patients have these conditions and are unaware, and an eye exam is important to detect this. But blood pressure, can you detect stroke or a risk of stroke from an eye exam? Yes, you can. When we look at patients' blood vessel changes in the back of the eyes and see changes, those patients could be at risk for stroke, specifically if their blood pressure is not well controlled or their cholesterol is not well controlled. Having blood pressure, elevated blood pressure, uncontrolled blood pressure, having high cholesterol can cause blood vessels in the back of the eyes to burst and bleed. You hear the term stroke in the eye. Well, that's what happens in the back of the eyes. You could see, here a burst of a blood vessel. The vein has burst and caused a lot of bleeding. In this image here, a vein has burst and caused a lot of bleeding because they get, clogged up. And so here you can see artery is clogged up. Here's a little clog, an embolus. a Hohenhorst plaque, which is a cholesterol plaque. And because you can't get oxygen, you have this white sort of ischemic change. Now, if that happens in a center artery, then that is a stroke emergency when we see patients with sudden loss of vision. And these clogged arteries and vein can lead to a sudden loss of vision. You wake up and you can't see through the eye. And if you can't see through the eye and you come in to see us and you have artery occlusion, that is equivalent to having a stroke. So we always will send those patients to the emergency room, a stroke urgent center, because that is an emergency. You need to have that patient evaluated stat because potentially there's other issues on the brain. So looking in the back of the eye, looking at the blood vessel integrity, if you look up here in this image, you see the artery and vein and how they cross. So we like to look at how they cross the arteries and vein. And if we see changes in how they cross, that could be an early predictor of stroke. So if you have family members that have high blood pressure, you have family members that have cholesterol or friends, they should be getting a yearly dilated eye exam so we can detect changes in their blood vessels. As mentioned earlier, patients are at risk for macular degeneration. You see a lot of commercial about eye-friendly vitamins, lutein and zeaxanthin for patients. You always hear that the macular degeneration doesn't impact African-American individuals, but it does. It's a genetic disease. So if we have someone who's multiracial, biracial, you carry the genetic profile for macular degeneration, you're at risk for macular degeneration. And so again, looking at the macula, you can see these yellow deposits. They shouldn't be there. It's like tartar on your teeth. If you don't brush your teeth, tartar builds up in the back of the eye due to genetics and aging. You could get this buildup of a substance called drusen, and it shouldn't be building up. And when it does, it can cause problems in the macular area. It can cause loss of vision or changes in the cells, and it can cause new blood vessel to grow in the macular area. And if new blood vessel grows in the macular area, there's potential for bleeding. And so the patient can't see centrally. So I'm looking at your face or you're looking at my face, that's your central vision. Patients with macular degeneration will have changes in the center vision. Of course, any patient that has profound vision compromise, we do have, especially in optometry, we have low vision devices, magnifiers to help and improve the quality of life. These conditions don't have to rob you of your quality of life. But if we can prevent it, it's important. And again, a dilated yearly comprehensive eye exam is important. Patients might complain of spots in their vision. I woke up this morning and I see spots in my vision. I see, colored spots, or I see flashes of light, things of that nature. If a patient complains about that, it could be innocent aging. As you age, there's a gel in the eye called the vitreous. So think of the eye as a ball, the front of the eye, the back of the eye in the center. There's a gel. That gel is collagenous. I equate it to maybe Jell-O. When you have Jell-O and it's ready to be served, it's homogeneous, uniform. The gel is like that when you're very young. As you age, that gel has a consistency of liquid and solid. So imagine that Jell-O square being left on the counter. You come back after an hour, it's a consistency of solid and water or fluid like. So as you age, the gel changes, and sometimes you can see spots, a coalesced collagen in the vitreous. So you might see these spots. It's normal with aging. However, sometimes these spots and these flashes of light and the changes in the gel can pull on the retina, and it can cause a more serious problem, which is a retinal detachment. So if you have any friends or family that has sudden complaint of floaters, flashes of light, or changes in their vision, they need to be seen by an optometrist or ophthalmologist immediately. They should have a dilated exam to make sure there's no retinal tears, holes, or detachment like this. This patient had a retinal tear and it has led to a retinal detachment. This patient needs to have surgery. Here again, another giant tear in the retina from the gel pulling, and it's leading to a retinal detachment. The other thing that is important to note is that with a dilated eye exam, we can detect, tumors in the eyes. Can cancers occur in the eye? Yes, they can. Whether it's a vascular tumor or it's a tumor that's growing and is growing in the eye. And one of the tumors that's very prevalent is a melanoma. We know patients are at risk for getting skin melanoma, but you can get melanomas in the eyes as well. In young individuals, if you have a child who's very, very, very young and has a white reflex in the photography, that might be a sign that something is going on. It could be a potential tumor in that child's eye. But for our older adults, a lot of times there are tumors in the eye that the patient are unaware of. And the only way to detect that is with a comprehensive dilated eye exam. So here's an example of a small tumor here. This one is small. It could be a freckle, like a mole on your skin on the eye. And we have to examine it and do additional testing. We take photos to make sure it doesn't change over time. Or it could have changes that are indicative of a melanoma. And here in this image over here, this patient has a significant tumor. This is a very large tumor that's growing. So dilated eye exam is important to picking that up. Of course, you can have a picture of the eye, but it's important to make sure that that doctor is putting drops in the eyes and also taking a look at all aspects of the eye. The optic nerve, as you see in the video, the macula, the blood vessel, and the periphery of the eye. If you have sickle cell disease affects the back of the eyes, and the most prominent place where it impacts is the peripheral part of the retina. So again, a dilated eye exam will help detect early changes from sickle cell retinopathy. So I wanted to leave a lot more time for Q&A. Last time we didn't have enough time for Q&A, so I'm going to have Angela assist me with the Q&A chat box to make sure. But I just want to make sure that everyone understands that healthy eyes start with a dilated eye exam, and that it's important that as part of your yearly comprehensive eye evaluation that your optometrist, ophthalmologist is dilating your eyes. They didn't do it this year. It's okay to do it the next year. But every year for older individuals, it's really important. And it's important to talk to the patients. This is an image of myself talking to the patients about their eye health. And so it's important that your optometrist, your ophthalmologist take a moment just to let you know how your eyes are doing, whether there are changes in the back of the eyes, whether there's cataracts, there's diabetic retinopathy, what's the follow-up, what's the management plan. To also ask your doctor, talk to your doctor. Doctor, you say I have diabetic retinopathy. Is it early changes? Should I be seen by a retinal specialist? Can I be managed with follow-up? So also ask questions for yourself. I always empower the patients to ask questions so that they know as much about their condition, their disease, so they can always take those proper necessary steps to protect their eyesight. I want to one more time say that the Eye Health My Health website is available. It has a lot of resources and information specifically for African American communities, again, because we are disproportionately impacted from these diseases. And this is the website here. So if you were to go on the NEI and you type into your Google search, Eye Health, My Health, it would take you to that website as well. And then other resources that are available, and we'll give these resources if you need them to you. For patients, you can get free or low cost eye care. Can also learn more about other eye conditions. And it can also, we have site available to give you a virtual experience. So what it's like for a patient that has glaucoma, what does a patient with glaucoma see? How are they seeing? How is a patient that has diabetic retinopathy or cataracts, how are they seeing? So that you can educate patients and family members or other, community members as well. And then you can connect with the NEI on social media. Here are some of our social media platforms. So we're on Facebook, Twitter, LinkedIn, and YouTube. And with that, I want to say thank you so much. And I want to be here for all of the questions. So Angela, let's go through those questions.
Yes, and thank you, Dr. Reynolds, as always. Such great information, thoughtful, well presented. We appreciate you. Um, yes, let's go to the questions. One of the first ones we had was, can floaters be dangerous? Now, you spoke about floaters, but the question was, are they dangerous?
So, interestingly enough, floaters can be innocent. So floaters could be a sign of aging. Remember, I mentioned earlier that gel in the eye changes as you grow up. You like that? Grow up, Angela.
Yeah.
As we, get older and wiser in our years, that gel changes. And so it could be a normal floater, which is part of aging. However, floater with flashes of light. So if you start to see, the best way to describe flashing of light to the audience is a light bolt, like a, lightning bolt. So like, if you close your eyes and you see like a lightning bolt and it's not going away, that is a red flag. That says something else is going on. That means that gel in the eye called the vitreous is pulling on the retina, and potentially there could be a tear or a hole that in the peripheral part of the retina. If there's a tear or hole in the retina, then it can lead to a retinal detachment. All right. So that's why floaters can be innocent. But if you have a floater with the flashes of light, it can indicate that there's a retinal detachment. Also, too, if you're a patient that has diabetes and you have floaters, it could be that there's blood in the vitreous. Remember, I mentioned earlier, you have these new blood vessels and these new blood vessels leak. So one of the things that these new blood vessels can do is leak into the gel, and it's called a vitreous hemorrhage. So now you have a hemorrhage that's causing the floaters. If you have high blood pressure, high cholesterol, you're at risk for having a broken blood vessel, right? Remember I said that a lot of times patients don't know that they have a broken blood vessel or a stroke in the eye, as some people may call it, but it can cause you to have a floating spot. So 3 things. If the floating spot is not getting any better, if you notice the floating spot is getting worse, if you notice flashes of light, you need to be seen right away. In fact, what I will say to the audience, if any floating spot, just be seen by an eye doctor to make sure that that floating spot is could be benign or it could be serious. So any onset of a floating spot, see your eye doctor.
So the importance is for us to get our dilated eye exam.
That's right, a
Right?
dilated eye exam.
Exactly. Yes. So a family member did not had an eye infection and did not properly care for that eye infection and is now blind in that eye. So could you speak to the improper care or the proper care of eye infections
Well,
and
that really
pressure?
Yeah, that depends. It's really hard without seeing that patient what occurred. So there's different sort of eye infections. So, when we talk about a red eye, a patient presents with a red, painful eye or red eye. It could be a viral infection. So we saw a lot, viruses can infect the eyes. One of the most common is, like a cold virus, we call it pink eye in the eye. But still, even with a pink eye, it can cause problems on the cornea, not just on the conjunctiva, which is the thin film over the white part of the eye. So you want to be seen to make sure what type of infection. Is it a viral infection? Is it a bacterial infection? And so bacterial infection, especially on the cornea, if it's due to contact lens wear and it's not properly treated with antibiotic or aggressively, can progress and cause loss of vision. So it's really important to ascertain or be seen by an eye doctor so we can better clearly ascertain what type of infection. Is it a mild, moderate, or severe infection in the eye? So without seeing this patient, I'm not sure what happened, but eye infections and how we treat eye infections can lead to, changes in the eyes. It can lead to, eye pressures. Some patients have eye inflammation. And if they have eye inflammation, they may be treated, Angela, with steroid drops, drops for anti-inflammatory drops. And steroid is a type of anti-inflammatory drop that can cause the eye pressures to go up, and that can lead to risk of glaucoma. So without knowing, any red eye, any patient that has a red eye, any person that has a red eye need to be seen by an eye doctor immediately. Do not wait, because the longer you wait, the more likely there could be changes. I will also say, if you're a patient that has diabetes and you have an eye infection, you have to be seen right away, right? Because, bacteria like sugar. And so that's why patients with diabetes, you've got to be seen. If you're not seen and treated properly, it can lead to other complications. But anyone with any sort of red eye or any sort of irritated eye, painful eye, needs to be seen by an eye doctor. And it could be the front of the eye problem, but it can also be the back of the eye problem as well, the retina. So part of assessing the patient is looking at the front, checking the pressures of the eye, checking the visual acuity, the overall anterior component of the eye, but also the back of the eye with a dilated eye exam.
Yes, great. Excellent, great, and thank you. You just broke it down so well for us, and inclusively so. Yes, so thank you again.
I see one more question
Yes.
for what
What
causes dry
causes dry
eye.
eye?
So dry eye is part of the aging process. So one of the cause is growing up. Our tear film doesn't work that well. So everyone that grows up will potentially have some dry eyes. Hormonal changes. Women disproportionately have drier eyes because of hormonal changes. Medications that you're taking, blood pressure medications, certain medications that you're taking can exacerbate and make worse the dry eye symptoms. Where you work, if you're in front of an AC all the time, if you're blowing the AC in your face, if you're not blinking properly, you can get dry eyes. So there's a whole list of different causes for dry eye. Again, one of the things that I'm going to recommend is that you have a comprehensive eye exam. As we have, dry eyes, we have new ways to treat patients that have dry eyes to make them more comfortable. So you just don't have to use drops all the time. So.
Okay, I have a few more questions for you here. In what specific ways does hypertension affect the eye? Now, you mentioned some of them, but what specific ways should we, as the Black community, know and recognize that hypertension does affect the eye in this way or format?
So when you have high blood pressure in your body, right? So just think about this. The body's blood vascular size is a little bit larger than the eye vessel size. So the eye vessel size is a little smaller, and it's the same caliber as the vascular size in the brain, right? So that's why it's important as a stroke risk, because it's the same sort of size of vessel. So we say micro for the eyes, microvascular, and we say macro for the body. But nonetheless, when you have blood pressure, the best way to explain it is, if you have a hose and you nick the hose, what happened to the hose, the back part of the hose, is that it straightens out because there's so much pressure in the hose. What happens with high blood pressure, there's mean arterial pressure that's increasing. So there's so much pressure. So the blood is flowing really fast through your vasculature. Does that make sense so far, Angela? When it flows really fast through the vasculature, it can slough off or remove the vessel lining, and then the vessel has to repair itself, and it becomes thicker over time. Or the fact that the pressure is so high in the arteries, if this is a vein and this is an artery, it can press down on that vein because that artery now has a lot of pressure. When it presses down on the vein and that vein gets nicked off, that's when the vein can burst and bleed. And why the eye is important is because the vessels in the eye are small. And so if I see changes in that way, the artery and the vein, if I see that artery pressing on the vein, that tells me the patient's blood pressure needs better control, number one. Number two, the patient needs to be checked for blood pressure. Or number three, take your medication as recommended so that you don't get a stroke, right? Or get a heart attack or a heart disease from that. So we educate the patients about that. If the patient doesn't take their medication, because, you know, blood pressure is a silent killer, there's no warning. But if the patient doesn't take their blood pressure because they don't feel like they have blood pressure, it could be high. Individuals are walking around with very, very high blood pressure. And so if that's the case, you know, we see changes in the eye, the patient is at risk for a potential stroke within 3 to 5 years. So that's why the eye is really important in patients that have blood pressure. Same thing with cholesterol. Cholesterol builds up in the lining of the blood vessels. So imagine you have a hose and it's open, like this, you know, this is open. And imagine that all of this is clogged up from cholesterol. Well, the blood now has a small little way to go. Sometimes that cholesterol piece of it breaks off, and that can cause problems in the eye and in the body. It can cause a heart attack or a stroke, and it can cause a blockage in the eye as well, and can cause sudden loss of vision.
We have a question in the chat for you, another one. What about sarcoidosis? It's in remission, but should that be included in the yearly exam?
Yes, sarcoidosis, an inflammatory disease that impacts the lungs, is a multi-system disease. It doesn't just impact the lungs. It's an inflammatory disease. You can get inflammatory, you know, arthritis with it, of course. It can impact the eyes. Sometimes the eyes are the initial sign that a patient has sarcoidosis. So we could see inflammatory changes in the eyes and also in the retina, in the back of the eyes. So yes, patients that have inflammatory disease such as sarcoidosis, rheumatoid arthritis, lupus, systemic lupus erythematosus, or if they're taking medications such as Plaquenil for lupus, they should get a yearly comprehensive dilated eye exam.
Okay, all right. Thank you, doctor. Why is keeping your optic nerve healthy so important?
It is really important because your optic nerve is your nerve that allows you to see. Without the optic nerve, you're blind. So imagine if the nerve in your leg doesn't work, you're paralyzed. You cannot walk, right? If your nerve in your hand is not working, you can't use that hand or that, you know, that arm. So the optic nerve in the eye is really important because diseases such as glaucoma have no symptoms, and that's why it's important to get a yearly comprehensive dilated eye exam.
Yeah.
Other things that can impact the nerve, a person can have a tumor that's growing behind the nerve and can cause nerve changes. Patients can have you know, new blood vessel at the nerve, and new blood vessel from diabetes at the nerve is not a good thing, right? It can cause, you know, other problems. So the nerve is important to keep healthy because it's your visual pathway. It allows you to see your visual world. And if the nerve is not working, the eye is not working.
Dr. Reynolds, what resources are available for caretakers who are caretaking for blind family members? I saw some in the chat, but any specific ones for caretakers that of which you are aware?
I'm not aware, but you know, and like I said, at the NEI, NEHAP, if you go on the website, we could look at some of the resources. I know get free low cost eye exams, especially for those that have caretakers and need the financial resources. That might be a resource. If you have individuals that have experienced loss of vision, NEI website, NEHAP website also has on low vision. So the term low vision really means, you know, for those that have compromised vision, what can we do to help them improve their quality of life? There are resources where you can get magnifiers to help improve the font size. You know, here in South Florida, we have the Lighthouse. You know, if you were to look that up, we have the Broward County and the Miami Lighthouse for visually impaired individuals. So that's a resource as well. You can, check into that. They kind of help the individuals that have visual impairment how to navigate their lives with teaching them, they can have digital clocks or clocks that speaks to them, things of that nature. And it's also a resource where they can go and learn, and have a community of other individuals that are visually impaired. So the Lighthouse, like I said, here in South Florida, we have the Lighthouse, a division of the Blind Service, where it helps our patients that are visually impaired.
Right. Can you speak to vitamins? I remember we spoke earlier. You mentioned about vitamins that help with better eye care. Vitamins, minerals.
Yeah, so you've probably seen a lot out there about eye-friendly vitamins. First thing I'm going to just say to all the participants is eat healthy, exercise regularly, and you protect your eyesight. You protect your eyes from the sun, protect your eyes from these computers, these digital devices. Take frequent breaks. They do have filters for if you're on a computer long, blue blockers is what we call them, to help kind of cut down on low wavelength of light damage to the back of the eyes. Eating healthy is really the best source. So, there's certain foods that have these eye-friendly vitamins in them. You can also take eye-friendly vitamins, but it's getting it in via foods. Salmon is a good resource. Egg yellow has good source of lutein. But if not, taking lutein, age-related eye disease study, macular eye disease study was a big study, and it found that certain eye-friendly vitamins are really good for the eyes. So lutein and zeaxanthin was one of them. If you have macular degeneration, your doctor is going to recommend AREDS, which is the age-related eye disease study component that has various nutritional support in there for our patients that have macular degeneration. But I always tell patients, if you were, as you're growing up, Centrum over 50 and other vitamins, some of these have lutein and zeaxanthin as well. Omega-3, I take omega-3 myself. It's good for cardiovascular support. It's also good for the eyes. Blueberries are a good source of antioxidants. Strawberries are a good source. But again, this is talking to your doctor, especially for my patients that have diabetes, making sure that your doctor is aware of your nutritional support. You might want to meet with your nutritionist to make sure what is good and safe foods for you as a patient that has diabetes to take. But studies have shown that eye-friendly vitamins such as lutein and zeaxanthin can be beneficial for our patients with diabetes as well, not just, macular degeneration.
Good. I'm getting a hold of that, and I thank you because when I step into my next eye exam, or if anyone of our attendees, how could we best advocate? What are some good questions to ask as seeing people in the Black community? When we go in, I have had an exam that was so rushed. So what can we do to say, okay, this is not what I believe that I should be, receiving at this time? Do you know where I'm going? What are some good questions? How could we best advocate for equity as we step into to get care for our eyes?
Well, I think it's important to ask your doctor, how are my eyes? Are they healthy? My vision is 20/20. I heard you say that, but are there any eye diseases? Dry eye, cataracts, anything, glaucoma, any signs of glaucoma. So I think it's important to ask, how are my eyes as far as the health of my eyes? Do I have any glaucoma, doctor? Do I have any cataracts? What stage of my cataracts? For my patients that have diabetes, it's so critically important that your eye doctor communicates with your treating physician, Angela. So if you are coming in for an eye exam, not only are you asking the doctor, how are my eyes? Do you see any sign of bleeding in the retina? Any signs of glaucoma, because I have diabetes. And if they say no, then please make sure my doctor gets a report, because that bi-directional communication, hopefully the doctor sent it something, but just communication with the treating physician is really important. Like I said before, a lot of times patients come in and I detect that they have changes from diabetes, but they don't have a diagnosis of diabetes. So I have to write a letter to a physician for that patient. I may have to get that patient a physician visit, initiate a physician visit, but make sure your eye doctor is communicating with your healthcare practitioner. That's best practices. So all eye doctors should do that. Just a quick note to the doctor, a summary report that the patient has retinopathy or does not have retinopathy. Also, too, your eye doctor should be asking how well controlled you are with your diabetes. Angela, if your patient has diabetes and you go for an eye exam, they should be asking the ABCs of diabetes. How's your glycemic control? And if you say 14, they should take a minute to talk to you that that's not a good number. Does that make sense?
Yes.
And then I just really advocate for minority patients, for all individuals, that you ask questions, right? So the specific question is, how are my eyes? Are my eyes healthy? Do I have glaucoma? Do I have diabetes changes? Do I have blood pressure changes? If you have blood pressure, right? Do I have cataracts? You want to ask these, especially as you're aging and growing up. You're at a higher risk. So ask those questions of your eye doctor. Then, like I said before, make sure they communicate with your treating physician. So, doc, you told me everything is good. Can you send a note to my treating doctor?
Good. Good. Thank you. That part, sending the note to the treating doctor, I have to check that out. And I believe that we all should as well check that out. So just a couple more questions. Allergens. How about allergens and long-term effects? What are some long-term effects of allergens on the eye?
Well, when we talk about allergens, so patients can have allergic conjunctivitis or, red eyes that is due to allergies. And we know allergens are the precipitators of the red eyes. And so what I always say to patients that have allergic conjunctivitis. Well, I have to see the patient to make sure it is allergic conjunctivitis, Angela. But anyone that has allergies and you're going into the eye doctor, if you're being treated with certain medications, such as over-the-counter medications or eye drops for like a refresh tears, those are okay. But if you're being treated with anything stronger, like a steroid, then that doctor should be following you very closely. Okay. Also, too, if you have allergies, it's a chronic disease. It doesn't just go away. A lot of times we tell patients to avoid the allergen, whether it's dust, whether it's ragweed or pollen, but you can't always do that. So make sure that you're seeing your doctor frequently. If you use an eye drop, sometimes you can use certain allergy eye drops, without seeing the doctor. But I say have a close relationship with your eye doctor where you're seeing them frequently to make sure that everything is still healthy. Can allergies of the eyes cause other problems? Severe allergies. And some medications can dry out the eyes. So if you're taking like Allegra, or not Allegra, but Flonase, and it has the D, or some of these decongest, it can dry out the eyes. So it can cause the eyes feel drier too, but you're taking it for your allergies. So you might have some eye problems as well. Remember I said medication can cause dry eyes. Then you want to talk to your eye doctor about that.
Okay, I do have a question in the chat. Last question for the day. I was told that I have cataracts, but they are not ready to be removed. How do you know when they are ready?
Well, there are two ways that you know they're ready. A yearly comprehensive dilated eye exam. That's number one with your eye doctor. Also checking that, he's going to be checking your visual acuity. If your vision has been compromised, significantly, then he would refer you or she would refer you to a cataract surgeon for cataract surgery. We don't want to do surgery on everyone that has cataracts, right? Because there are complications to any procedures. And so there is a visual requirement. Also, too, if it's impacting your quality of life, if you have a cataract or cataracts and you're an accountant and you can't read and your vision has been compromised, there are some insurances that will allow for the patient to have it earlier, but there are stipulations with the vision. So I know a lot of times what I say to my patient, unfortunately, things aren't as sharp as it used to be. Night driving is not as clear as it used to be, but you're just not ready yet for cataract surgery. Your vision is mildly decreased. It's not perfectly 20/20, but it's not where it should be for cataract surgery yet. Once my patients get close to that number, when we do a visual acuity check, that's corrected. That means that they had a assessment of their glasses, the latest prescription, and their vision is compromised, then we refer them out for cataract surgery.
Yes, and thank you. Dr. Reynolds, we're at 2:01. We took our last. I saw another question in the chat, but I will respond. I believe you answered that already. What are the signs of diabetes? The first signs of diabetes in the eyes. I remember that you just mentioned that you, in examining a patient, you saw some diabetic signs in the eye, and the doctor had not. Their primary doctor had not mentioned, but I'll let you continue.
So really quickly for the next minute or so, remember what I said earlier is that patients with diabetes, there are 8 million people walking around that don't even know. So if they have bleeding in the back of the eyes, any of those broken blood vessels that you saw in the video, to get a blood test to be seen by the doctor. Patients that have prediabetes, they can have borderline elevated glycemic numbers, but the back of the eyes can show retinopathy. So it's important for me to communicate with their treating physician, because if they have early signs in the back of the eyes with borderline glycemic control, they need to be on medication, right? A really strict diet. So the signs that we could see are those early bleeding signs in the back of the eyes. But I do want to leave without, I want to say something really quick because, you know, I sometimes speak for the American Diabetes Association. Diabetes can affect all aspects of your eyes. It can affect from the top of your head to the bottom of your feet, from the front of your eyes to the back of your eyes. If your blood sugar is high, your vision can fluctuate. So one of the symptoms of diabetes is change in vision. The other thing, diabetes causes dry eyes. So patients with dry eyes and one of the cause could be the diabetes, and especially if it's not well controlled. Patients can get eye infections from diabetes. Cataracts, you're 60% more likely to develop cataracts earlier with diabetes. So if you have diabetes, you should be checked for cataracts. Patients with diabetes are also at risk for glaucoma. It can cause bleeding in the back of the eyes, retinal changes. It can cause, I wouldn't say it's a retinal detachment at the very end. You have these new blood vessels, it bleeds, it can pull on the retina and cause the retina to be detached if you don't treat those new blood vessels. So diabetes can cause a whole host of problems. And I always say for my patients that have diabetes, we're checking the front to the back. From the front to the back.
Yes, ma'am. Thank you, Dr. Reynolds.
Thank
Such a
you.
pleasure again. We appreciate it. We appreciate everyone's attendance and coming to be a part of our webinar. Thank you. Have a good afternoon, and see you on the next round in September. Okay, bye-bye. Bye-bye.